Hey guys, welcome back again to another episode. So today we are going to discuss on things that you have to do when you realize you are pregnant. We have talked about the do's and the don'ts during the pregnancy, but today we are going to discuss on when you realize you are pregnant. What is the first things you have to do when you realize you are pregnant? First of all, you have to find a doctor and schedule her first visit. This first visit, you are going to, during the first visit, this is where you're going to get tested, and also that's a blood test and also the urine tests that you took at home, and you have to go and visit the doctor who is going to confirm finally if you are pregnant or not using the blood test. So they are going to take your test and also they check whether you are pregnant using the blood test. This they also have to schedule you the visits. So your doctor is going to schedule you the visits. This includes from 28 weeks. 28 weeks you have to, from the first visit to 28 weeks, you will visit the doctor once per month. And from 28 weeks to 36 weeks, you are going to visit this doctor twice a month. And in 36 weeks, until birth, you are going to visit the doctor every week. So you are going to visit the doctor weekly. That's where you are going to be calculated the due dates and the ultrasounds. They are going to listen to the ultrasounds and the rest, the progress of the baby and the rest of the due dates that you're gonna give birth. So they are going to calculate you for the days that you are going to give birth and also give you the due dates. So you have to visit a doctor and schedule for the first visits. Secondly, you have to take the prenatal vitamins. During these visits, it's the time when you are going to get these prenatal vitamins, because you need a lot of vitamins in your body. So these prenatal vitamins, they are going to provide you with vitamins and minerals that you need, including the calcium, the vitamin A, the vitamin C, D, and E, the vitamin B12, zinc, copper, and magnesium. So these are prenatal vitamins. They are the ones that you are going to get from the hospital. Once you have been given these medicines, don't stop taking them, because they are very helpful in your growing fetus in your home. So you have to be very careful. You take them regularly. Kama umeambiwa take them daily, just take them daily. Don't stop until the doctor changes the medicines for you. So in first trimester, the second trimester, and the third trimester, you are going to take these prenatal vitamins. Secondly, you are going to discuss the medication, if there is injections, if there are some of things that you need to do, and there are these vaccinations that you are going to get during the pregnancy, especially on the third trimester. That's when you get injected. So you are going to discuss your medications and feel free to ask any questions to your doctor. Ukisikia hivi, just be free to ask anything. So don't fear anything because this is the best time that you can talk to your doctor. Then you have to plan for your work, because there are these times that you are going to ask for permissions. If you are employed, you are going to ask for permission from your employer that you have to go and visit your doctor. So you have to get a plan for your work. The other one, you have to avoid substances, especially we have talked about the previous video. So these substances include taking alcohol, a lot of caffeine, and the rest. So you have to avoid taking wines and spirits, which may cause damage to your baby. The other one is decrease the caffeine that we have talked about, taking a lot of sodas and the rest. We have to avoid taking sodas. So the other one is the other one is refresh your nutrition. So stay hydrated. You have to take a balanced diet food so that you may increase your you may increase everything in your body, because you need a lot of things in your body while you are pregnant. Then the other one is prepare for morning sicknesses. This occurs firstly in the 6 weeks of your first trimester. So this is mostly in first trimester, but you can have substances that you can substitute in during your morning sicknesses. First of all, you can take anti-nausea bands. You can also use the saltine crackers, the peppermint tea, the ginger tea or the candies, and also you can use the carbonated water to help you in morning sicknesses. These morning sicknesses, most of it comes in 80% of women who are pregnant. So it can occur not even in the morning, but any time of the day. It can come either in 8, 9, 10, or even at 1 after taking your lunch. Even jihoni, it have no time, but it is called morning sickness. So the other one is no miscarriage signs. So you have to know the signs of miscarriage, especially when you are pregnant. You have to learn things that may cause miscarriage and the signs of the miscarriage. First of all, the signs of miscarriage can be bleeding. If you get bleeding, rush to the hospital. That can be a sign of miscarriage. Secondly, if you get a cramp, if you have those abdominals that are crampings, you have to rush to the hospital, because that may be sign of a miscarriage. The other one is a pain. If you feel a pain in your abdomen, that can be a sign of a miscarriage. So you have to rush to the hospital. The other one is a foul smell discharge. If there is that bad smell, you have to go and see your doctor, because that maybe can be a sign of a miscarriage. These are some of the things that you need to consider while you realize that you are pregnant, and it is a mandatory to go and visit a doctor once you realize that you are pregnant, so that you can start taking the prenatal vitamins, because they are very, very important in your baby's growth. And guys, if there is a question, you can drop your question down on the comment section. I'll be free to answer every one of you. And yeah, thank you guys for always watching. If you have a question, don't hesitate to ask, because I'm very free, and I'll ask and I'll give you the correct answers. Yeah, let's do research for these things, because some of us, we are suffering on this pregnancy journey. Let's make the pregnancy journey so simple and so understandable. Thank you guys for always tuning in. Leave a comment in the comment section, and also I'll be very appreciative to always answer your questions on the comment. Thank you, and keep liking the video so that YouTube can recommend us to more audience, and I'll appreciate you so much. Bye guys, see you next time on the next video. Bye.